Hello, I'm Dr. Bruce Eimer. I'm a licensed psychologist here in South Florida, and I'm also a certified hypnotherapist with the International Medical and Dental Hypnotherapy Association. This coming Wednesday and Thursday, this week, coming up in just 2 days, April 22nd and 23rd, I am presenting my 2-day webinar called Hypnosis for Treating Depression. This is a last-minute call to remind you about this webinar and why it is important for you to take this webinar. As you know, as a professional hypnotherapist, for years it was discouraged to use hypnosis for treating depressed clients. And there are several myths that have been promulgated which account for this reluctance. One of them is that hypnosis is a form of treatment that makes people into unthinking zombies. Of course, that is furthest from the truth. We know that people who are depressed often lack initiative, lack motivation, and have trouble getting up and moving. Of course, depression comes in all types of sizes and types, but hypnosis as a modality, as a tool, is very, very useful for enhancing any kind of therapy that a clinician uses to treat patients, as long as the clinician is experienced, competent, and skilled in treating patients with that particular type of disorder. In this workshop, what I'm going to do is I'm going to cut through all of the myths that account for the reluctance on the part of hypnotherapists for years in treating depressed clients with hypnosis and hypnotherapy. And I'm going to provide a very intense, in 2 days, didactic and experiential workshop that will address everything that you need to know to begin to start using hypnosis in treating depressed clients, which doesn't mean that you're going to be an expert after 2 days. But what it does mean is that you're going to understand things that perhaps you never have, and that you'll have information that you'll be able to further avail yourself of, sources that you'll be able to consult so that you'll be able to learn more, but you'll have the fundamentals and the basics. We're going to cover how to conceptualize depression. We're going to cover models of depression. We're going to cover the medical model, the psychiatric model, different nosologies, most namely the American Psychiatric Association's DSM. We're going to cover different theories and models of depression going back to the Freudian view and coming up to various modern views, which include the behavioral point of view, the cognitive point of view, the attributional point of view, the interpersonal point of view. We're going to cover these models. I'm going to teach you a new model that I've developed for understanding depression, which I call the AWARE model, and it builds on the idea that depression needs to be listened to and tamed so that the depressed individual develops a better understanding and rapport with him or herself, as opposed to trying to fight the depression, struggle with the depression, or kill the symptoms. So we're going to cover conceptualization, we're going to cover models, we're going to have a bunch of experiential exercises that will allow you to explore your implicit beliefs and what you know up to this point about depression and whether or not it can be cured, and if so, how. We're then going to talk about how hypnosis can specifically be applied to enhance the use of any particular type of psychotherapeutic approach that you've been trained in, that you use, and that you want to continue to use. So by using hypnosis, you won't have to throw out your preferred therapeutic model or approach. You'll just be able to enhance it, enhance its efficacy, and add to it. Okay, we're going to cover in this workshop a variety of hypnotherapeutic interventions for treating depressed clients, and I'll teach you how to conceptualize what hypnotherapeutic interventions are appropriate for what type of clients, depending upon how you assess the clients, depending upon what type of depression you assess a client as having. Now, if you're a professional hypnotherapist, you're not a licensed clinical mental health professional or a licensed physician, then you're clearly, ethically, and most likely via your state legal guidelines, are going to have to work in tandem with, in collaboration with, or under the supervision of a licensed medical or mental health professional that is licensed to treat depressed individuals. Okay? But if you are licensed as a treating health professional that within the scope of your practice you're able to treat depressed clients, then you'll be able to use hypnosis along with the therapeutic approaches that make the most sense based on your training, experience, and of course, your clinical formulation of the client. Okay? So I'm going to be demonstrating, you'll be experiencing, and you'll be practicing how we can use hypnosis to enhance cognitive therapy, how to help clients to identify and refute their cognitive distortions, both in the waking state and under hypnosis. We're going to cover how to help clients to identify skill deficits that they have in a waking state, and then we're going to experience and go over hypnotic techniques for improving the speed and the thoroughness for a client to develop new skills and new ideas. We're going to cover how hypnosis is useful for helping someone to build coping skills. And we're going to cover when and when not hypnotic regression therapy is indicated, and then how to do it precisely to help a depressed client to identify core values and skills that he or she never learned in their childhood, reformulate what that means in his or her life, and then develop those skills now in the present as they envision a better future where they'll be doing what will have been better to have done. I'm going to teach you a model of therapy that I've developed called core values therapy, and I'm going to help you use the model along with hypnosis to help depressed clients. I'm going to teach my acceptance and commitment model, which basically is my aware model of hypnotherapy. I'm going to cover in depth Michael Yapko's model and theory and his work, his large body of work on using hypnosis to treat depression. He's a pioneer in this area, and I am indebted to him for helping me to develop many of my conceptualizations and working approaches to treating depressed clients using cognitive behavioral therapy as well as hypnosis. This is a very important workshop to take at this time when social isolation, which we have always known to be one of the antecedents for brewing depression, is now being prescribed for everyone's safety and medical health. So in this age of COVID-19 and social isolation and social distancing, if you will, and self-isolation, there's more and more depression. People are in more pain, especially those people who have been vulnerable to depression, which makes it more and more difficult for them to eliminate harmful and unhealthy habits that hypnotherapists traditionally consider the bread and butter of their work. This is a time where there's much more clinicians needed than we have available, mostly now through online systems such as Zoom and other platforms to work with clients so they can stay in the safety and the comfort of their homes while you're in your office or your home, and you're using hypnosis to help them to become undepressed. It's important to understand before I close, and your friends, family, colleagues might be asking you, oh, you're going to learn how to hypnotize somebody to not be depressed? The answer is absolutely not. It's not that simple. Depression is complicated. Depression comes in many forms. You're going to learn how to assess the type of depression that the client presents with, and then you're going to learn how to determine what therapeutic interventions and techniques are indicated as part of a treatment plan for helping that individual to become less depressed and more hopeful and more positive and return to a more normal level of functioning. And you're going to learn how to use hypnosis to enhance your use of those therapeutic strategies and techniques. Last, I already said last, but I'm going to say it again. I want to say that hypnosis is a tool. It's a very powerful tool that can be used by health professionals across the board that are skilled and competent and trained in their particular discipline to enhance what they do. At the same time, hypnotherapy is a valid profession. Well-trained, experienced, competent, professional hypnotherapists can help many people get better in many ways, as long as we, and I consider myself to be a professional hypnotherapist as well as a licensed psychologist, as long as we don't practice outside of our areas of competence and our areas of licensure. Okay? All right. Well, this workshop is going to be a pleasure to teach. I feel that I'm going to grow from the 2 days of doing this as much as you are, so I urge you to register. It's experiential. It's a feel-good workshop. You're going to learn techniques, and you're going to learn by experiencing, doing, and practicing. So go to imdha.com to register for this 2-day webinar. In fact, I think they have a lower price now, and it's a bargain. I'm not sure of the price, but for the 2 full days, it's really a bargain. And I urge you to go to imdha.com and register. You will be happy you did. And if you want to find out more about me, Dr. Bruce Eimer, go to my website, www.bruceeimer.com, and that's BRUCEEIMER.com. My office phone, if you want to call me last minute to decide if you're on the fence whether or not to take my workshop, my office phone number is 561-377-1039. That's 561-377-1039. See you there. Stay safe, stay smart, and stay well.